Hello, so for my individual case study, I decided to cover the topic of psilocybin, specifically the legalization of it when it comes to its use in therapeutic studies. And this is a state federal issue, so it would be between the federal government and the decriminalization of it statewide, obviously, but the specific state that we're looking at when it comes to all of our statistics and this case study is going to be Denver, Colorado. To give a little backstory on the entire topic, psilocybin was made illegal by the Controlled Substances Act. This happened all the way back in 1970, and when that happened, it was labeled a Schedule 1 drug. And Schedule 1 is something that has no current acceptable medical use. So they didn't see any use for it. Obviously, with different studies, we came to see that there are a lot of medical benefits, such as being able to help resist depression and combating things such as PTSD. We also see that it helps with things such as nicotine dependence. When you go through psilocybin studies, you can help wean yourself off of nicotine. And all of these things combined has led to more acceptance and interest in psilocybin in the United States. May 2019, Denver, Colorado became the first city in the US to decriminalize psilocybin mushrooms with 50.6% of the vote. And a review panel appointed by the Denver City Council issued a report in November 2021 after a while, saying that there are no significant negative impacts of decriminalization of psilocybin on public safety, which is obviously a very good thing. We see that there are other areas currently legalizing psilocybin, such as Colorado, certain cities in California, and Seattle. This issue is also topical, as in 2024, there are going to be healing centers put into place. And these healing centers are going to be legal areas that you could take psilocybin in therapeutic ways, licensed by the state. We'll get more into that in a little bit. So essentially, the first area that I'd like to cover when it comes to topics that we learned in class is going to be increased flexibility from the federal government when it comes to psilocybin therapy. If the states believe that they could properly regulate this treatment and it could lead to a net good for its constituents, then the government should allow the treatment as it could work for the particular demographic of that area. Allowing this experimentation could also allow other areas to use their research as a baseline for their own research. We also see that there's a lot of private investment into psychedelic pharmaceuticals. A company R&D has urged since 2018 that they have been providing a lot of studies into that, and there are a lot of other areas, and this is mainly due to the FDA breakthrough therapy designation for clinical trials of psilocybin for depression. So right now the FDA has labeled psilocybin into the breakthrough therapy designation, which again is a very good thing. And increased flexibility from the federal government in the context of allowing it to be decriminalized everywhere could allow for more studies, which could help more people. And this also ties into another big module that we learned about, which is healthcare. Because there is a lot of controversy on whether or not government aid and healthcare should be used towards psilocybin based studies. We see that according to the National Library of Medicine, small clinical trials have shown that 1 or 2 doses of psilocybin given a therapeutic setting can make drastic, and long term changes in people suffering from treatment resistant major depressive disorder. And this is major depressive disorder normally doesn't respond well to traditional antidepressants. So seeing psilocybin have a significant impact on it is very groundbreaking when it comes to the mental health field. Also, psilocin, which is what the intestines convert psilocybin into, shows promise in combating cluster headaches, anxiety, anorexia, OCD, and various forms of substance abuse, such as the nicotine that I tied into earlier. So when it comes to the healthcare area, we can see that there is a lot of kickback and need for regulation that occurs that is currently not allowing it to perhaps get as much aid as it should. But this is again something that the federal government and the states need to work on. A big thing that ties into another area that we learned that's preventing this is private interest groups. So right now, pharmaceutical companies are very against these new studies in medicine being presented. This is true because right now they have a stranglehold on the mental health industry, and they make a lot of money on medication management for things such as depression and other mental health disorders. So right now they're generating so much money, they don't want there to be a long-term cure. So they're currently lobbying against the possibility of the legalization in other areas in order to maintain that stranglehold. And we do see that there are areas that are currently growing interest. This ballot initiative that I talked about earlier that comes into effect in 2024 was just passed in November 2022. So what it does is it legalizes healing centers, it decriminalizes possession and growing, and it is licensed by the state's Department of Regulatory Agencies, which allows people aged over 21 and over to go in there and take these psychedelics under supervision, which is a very good thing and shows a lot of promise in the state's competency to be able to handle these type of things. When it comes to a solution between the current state government battle, when it comes to the gray area of psilocybin, I believe the best solution would be to just completely legalize it. We see that it does have a lot of benefits backed by science and the FDA, and ultimately it should be up to the states to make a decision, or perhaps even the cities, because they know their demographics best and they can see if it will help or hurt that specific area.